About 8 years ago, I walked into high school just as I did every other day. You know, you go to your locker, you get your books for the day. I'd stop and talk to my friends in the hallway and then make a mad dash for first period to get there before the bell rang. I love school. I was a senior. I was looking forward to graduating soon with all my friends and going to college. And I remember, though, that day walking into my fourth period class, which was economics. I took my seat, waited for class to begin just as I did every other day. And my teacher began the lesson, and I was sitting there listening and taking notes when all of a sudden I got this awful feeling, kind of an antsy feeling, like I just couldn't sit still. I had to get up or get out of there. And my hands began to get sweaty. My heart was racing. I had difficulty breathing. I couldn't figure out what was wrong with me. I began to get dizzy and feel faint. And I literally thought, as this was happening, I said, what's wrong? I think I'm going to die. I literally thought I was going to die, that I felt this awful. And everything all of a sudden got kind of dark. And that I was going to pass out. And little did I know that this was my first of many anxiety, or as you probably all know, panic attacks. I went to school the next day and I had another attack in fourth period. The same thing each day for the next week. Bam, fourth period, panic attack. So I actually started fearing going to fourth period because of this feeling. And, pretty soon I began to have them outside of class. And, I stopped going to the places where I'd had them in fear of having another one. I began secluding myself at home because that was my safe spot. I felt safe there. I'd never had a panic attack. And I avoided, I didn't go to football games anymore. I lost touch with my friends and had missed so much school that I actually eventually dropped out and was unable to graduate with my class. And it was awful. I'd been to the doctor. I'd been to the hospital even. And I said, no, you're fine. Everything checks out. You're fine. My mom eventually took me, however, to see a psychiatrist. And that's when I was diagnosed with an anxiety disorder known as panic disorder. Having experienced this on a personal level, I can really, really see and understand the effects that it has on a person's life. Anxiety disorders are the number one mental health problem among women, and second only to alcohol and drug abuse among men. Anxiety disorders are commonly left undiagnosed because people, don't really understand what's happening or don't have the knowledge that these disorders actually exist. And, a lot of times they just go left untreated. And today I will be discussing the 3 most common types of anxiety disorders and the effects they have on a person's life and the possible treatments used to manage and relieve anxiety disorders. Anxiety is a normal human feeling. I'm sure you've all felt it at some point, whether it's the birth of a child or the loss of a job or test, or maybe you're having a medical procedure and you're anxious about that. It's a normal feeling. However, when the fear becomes so intense that it results in panic attacks or avoidance of certain situations, or if the anxiety persists even after the stressful situation or event has passed, then it is no longer normal. Then there's a problem, and it's safe to assume that you're dealing with some type of anxiety disorder. There are so many different anxiety disorders that are different. They're characterized by different fears, different feelings. However, the most common anxiety disorder is generalized anxiety. And generalized anxiety disorder is basically when a person has chronic anxiety and chronic worry. They're always worrying about different life situations. Maybe it's finances or relationships or your health. And according to the National Institute of Mental Health, 6.8 million American adults are diagnosed with this in a given year. And symptoms can include, like I said, frequent worry. You might be irritable, have difficulty concentrating or difficulty sleeping. Any of these can relate back to generalized anxiety disorder. Another common disorder is known as panic disorder. That's what I was diagnosed with. And, it's awful. It's basically a disorder that is, acute fear or apprehension, basically having a panic attack, for no apparent reason, no apparent cause, just out of the blue. And during a panic attack, a person might experience shortness of breath, difficulty breathing, heart palpitations, dizziness, sweating, numbness. They might have a fear of dying or losing control. And with panic disorder, they begin to worry about having another one, and soon, like I did, avoid the situation and where they had a previous panic disorder. And this disorder actually affects 6 million adults in a given year. And the last type of anxiety disorder that I'm going to talk about today is, it's called social anxiety. Social anxiety is the fear of embarrassment or humiliation in a social situation where you might be judged by others. Ironically, the most common fear is fear of public speaking. People with this disorder may have a fear of blushing in public, being watched at work, maybe signing or writing documents in the presence of others, fear of crowds, fear of exams. Any of these are symptoms of social anxiety. And these people will go long lengths to avoid these different social situations because their fear is so strong. Anxiety disorders cause many debilitating effects on a person's everyday life. These disorders can prevent a person from doing simple everyday things such as driving, going to the grocery store, just being alone. Some people just don't even want to be alone. They're so afraid. And it can cause a person not to travel, not to fly. People also can lose their jobs because they begin to frequently miss work. And anxiety disorders can also put a huge strain on relationships and marriages, especially if the person they're with, can't relate and doesn't understand what the person with anxiety is going through. Chronic anxiety and chronic worry can lead to weight gain and many other health-related issues such as heart disease. And these people with these disorders are unable to function in life and do the things they want to, and ultimately, this can lead to depression and even potentially suicide. So it's very important to recognize the symptoms and get treatment. There are many treatments available to manage or eliminate anxiety disorders. If your anxiety is minimal, you might benefit just from simple relaxation techniques such as deep breathing exercises or positive thinking. If your anxiety is more severe, there's different types of therapies that you can undergo to help treat this, such as cognitive behavioral therapy. Now, this is actually when a person, they're very involved in the recovery process. They learn about what's going on, they educate themselves, and actually identify the problem and what they're going through, and they begin to change the way they are thinking and change behavioral patterns until it relieves the anxiety. Another type of therapy is known as exposure therapy, and this is actually putting the person into a situation that creates anxiety for them over and over again until they actually become desensitized and it no longer affects them. There's also many medications out there on the market now that you can use to help relieve and reduce anxiety. And there's also been a study done by Oxford University that says Tetris, the old school game where you make lines and fit the shapes together, that actually playing Tetris can help relieve anxiety. So living in a society, that's so fast-paced and always on the go, it's no wonder that anxiety disorders are on the rise. I mean, we're living in one of the most stressful times in history, and with technology changing and everything changing, there's people just can't keep up, and it's very stressful. However, hopefully with the information that I've provided for you today, you'll be able to recognize symptoms of anxiety and the different types of disorders that are affecting millions of Americans, which might even be possibly yourselves or someone a family member, and the treatments that can be used to help eliminate and relieve the anxiety and hopefully regain your freedom and live a healthy, happy, anxiety-free life. Thank you.